Good day.
Hello, everyone.
Hello.
Hi, everyone.
Hi.
Hi.
Hi! So, good day to all of you. We are Group 1. So, in this video, we are going to tackle about the issues of nurses that they are experiencing all around the world, especially in the Philippines, based on our caricature. But before that is to know what is a nurse and what is their purpose in the medical field and their contributions in a society. So, let's proceed.
So first, what is the definition of a nurse? A nurse is a healthcare professional responsible for providing care to individuals, families, and communities. They assist doctors and other medical professionals in various medical procedures, administer medications, monitor patient vital signs, and educate patients about their health and provide emotional support.
So, nurses work in hospitals, clinics, nursing homes, schools, and other healthcare settings.
What is the purpose of a nurse and what are their contributions in the society? Nurses play a crucial role in healthcare, providing direct patient care, administering medications, educating patients and families, and advocating for patient needs. They contribute to society by promoting health, preventing illness, and assisting in the treatment and management of various medical conditions. Additionally, nurses often serve as a bridge between patients and other healthcare professionals, ensuring holistic care and fostering positive outcomes.
So, now we are going to show you our two caricatures and explain it to you what is the meaning behind them.
Hi! I am Glory E. Alba, and welcome to our video showcasing the art of caricatures. So, our topic is all about nurses, as nurses play an indispensable role in the healthcare systems worldwide, serving as a frontline caregivers who provide essential medical attention, compassion, and support to patients. Their dedication, resilience, and tireless efforts are vital in ensuring the well-being of individuals and the communities. Despite their crucial role, nurses often face numerous challenges, including long hours, emotional stress, and demanding work environments. Imagine a profession built on compassion, dedication, and tireless commitment. Now picture the same profession grappling with financial strain, uncertainty, and inequality. Think about it. Nurses are the ones who take care of us when we were sick, the one who comfort us when we were scared, and who work long hours to make sure we're okay. But despite all of that, many Filipino nurses struggle to make enough money to support themselves and also their families. Many Filipino nurses work tirelessly. They often juggling multiple responsibilities and providing care under a challenging conditions. Yet their salaries often do not reflect to the magnitude of their contributions. This discrepancy not only undermines the moral and motivation of nurses, but it also poses significant challenges in attracting and retaining a skilled professionals in the field. Addressing the issue of nurse compensation is imperative not only to recognize the invaluable contributions of these healthcare professionals, but also to ensure the sustainability and effectiveness of healthcare system as a whole. Fair and equitable remuneration for nurses is essential not only for their well-being but also for the quality and continuity of patient care. As such, it is crucial for policymakers, healthcare institutions, and society as a whole to prioritize the effort to address the wage disparity. and to ensure that nurses receive the recognition, the support, and compensation they truly deserve. Investing the well-being and professional development of nurses is not only a matter of fairness, but also a strategic imperative for building resilient and effective healthcare system.
Hello, I am Angela Kate O. Ablan. Welcome to our video showcasing the art of caricature. In this poignant caricature, we delve into the challenges faced by the nurses dealing with the issue of low pay, entitled Recognizing the Struggle, Addressing Nurse Compensation Disparity in the Philippines. So through expressive illustration and thought-provoking commentary, the caricature aims to shed light on the financial struggles experienced by the nurses in their noble professions. Here, a nurse is standing in front of its ill patient, in which he stands only on a pile of coins despite having too much work to do, symbolizing the economic strain on their salaries. So the caricature could portray nurses attempting a juggling act with various hospital works while balancing itself on a coin or low pay. So the caricature encourages dialogue about the importance of fair compensation for nurses and the need for systemic changes to address the financial struggles that can impact their well-being and professional satisfaction.
Good day, I am Georgette Balagon and today I will be discussing on what is the caricature all about. The caricature recognizing the struggle, addressing nurse compensation, disparity in the Philippines illustrates the significant gap between the dedication and hard work of Filipino nurses, yet they still receive low salaries. According to a report by the Philippine Nurses Association, the average monthly salary of a nurse in the Philippines is significantly lower compared to other countries, despite the high demand for Filipino nurses abroad. The caricature highlights the systematic challenges of economic inequality faced by Filipino nurses who are often underpaid and underappreciated despite their valuable contributions to society. This caricature brings attention to their situation and calls for fair pay and better working conditions. This caricature's importance is to help people understand and support changes that could make Filipino nurses' lives better. It reminds us of the sacrifices nurses make and why it's important to give them recognition and to treat them fairly.
Hello everyone, good day. My name is Lavelle Jane Bersetti. This is our video presentation showcasing the art of caricature. I am here to present to you the conclusion of one of our caricature entitled Recognizing the Struggle, Addressing Nurse Compensation Disparity in the Philippines. So, in conclusion, that therefore nurses are not given enough credit to their hardship, to their dedication in taking care of more than one patient every single day, how they are being patient in every encounter, even if they themselves are feeling down or unwell, how they can compensate those loved ones who have just lost their loved ones in the hospital, how nurses struggle to adjust or to keep their emotions to themselves just so they can be professional in their fields. And it is showcased in our caricature that these struggles are not being seen, or it is just being blinded, or governments are being blinded by something and not being able to see the struggles of nurses, that therefore they're only given pennies lesser than what they deserve, what nurses deserve. That would be all. Thank you.
Hi everyone, I'm John Jusen Mabano, and I'll be the one explaining the issue of our second caricature entitled Seeking Fair Recognition, the Global Pursuit of Filipino Nurses Amid Salary Disparity. So let's proceed. So the issue of Filipino nurses seeking fair recognition amid salary disparity is multi-faced and significant in the global healthcare landscape. So Filipino nurses are widely recognized for their professionalism, dedication, and high level of training, making them valuable assets in healthcare systems around the world. However, despite their contributions, many Filipino nurses face challenges in receiving fair compensation and recognition for their work. So, one of the primary issues is the stark difference in salaries between Filipino nurses and their counterparts in other countries. While Filipino nurses often work in countries with higher wages due to shortage in their home country and the global demand for healthcare workers, they frequently earn significantly lower salaries compared to local nurses or nurses from Western countries. So this salary disparity persists even though Filipino nurses may possess comparable qualifications and provide the same level of care. So several factors contribute to this salary gap. Economic conditions and cost of living differences between countries play a significant role, as wages for healthcare professionals are often determined by local market forces. Additionally, immigration policies and regulations in destination countries can impact the rights and benefits afforded to foreign trained nurses, so potentially leading to unequal treatment in terms of salary and employment opportunities. Cultural biases and stereotypes may also contribute to the undervaluation of Filipino nurses' contributions. Some healthcare systems may perceive foreign-trained nurses, particularly those from developing countries, as less competent or deserving or of lower pay than their local counterparts. These biases can perpetuate inequities in the distribution of resources and opportunities within the healthcare workforce. So the issue of salary disparity and fair recognition for Filipino nurses extends beyond individual livelihoods to broader questions of social justice and equity in the global healthcare sector. Addressing these challenges requires collaboration between governments, healthcare institutions, and professional organizations, and advocacy groups to promote fair labor practices, advocate for the rights of migrant healthcare workers, and challenge discriminatory attitudes and practices within the healthcare professions. So by recognizing the valuable contributions of Filipino nurses and advocating for their fair treatment and compensation, stakeholders can work towards creating a more equitable and inclusive healthcare workforce that values the skills, expertise, and dedication of nurses from all backgrounds.
Hi there! My name is Margaret Rosella Giacchino from BSN 1A, and today, welcome to our video showcasing the art of caricatures. So for my part, I am going to explain the details of this drawing, the so-called Seeking Fair Recognition, the global pursuit of Filipino nurses amid salary disparity. So firstly, we have the cap and the figure. This symbolizes a nurse that represents the background, the situation of her career, her choices, and the obstacles and challenges that she may encounter in the nursing program. Next is the falling money. This represents a face salary disparities compared to the counterparts, the opportunity for a career development. Next is we have the plain end items. This symbolizes a great opportunities, benefits, and outcomes of going to other countries. As nurses is a global nursing shortage of the world in which this results on recruiting nurses from other countries. Next is we have the hands with the chains. So this represents or symbolizes as a barrier of something stopping you from a great opportunity for your enhancement and development of your profession. And that's it. Thank you!
Hi, I am Joshua Shane B. Valencia, and in this video, I'm going to tackle about the purpose and what is this caricature all about. So this caricature is all about the nurses in the Philippines want to work abroad for better pay, improved working conditions, and more opportunities for career growth. Because working abroad allows Filipino nurses to provide valuable experience and training, and to provide for their families back home. So the chain and this caricature shows that the people in the Philippines are preventing nurses from working abroad since our country requires more nurses to work here. So the purpose of making this caricature is to highlight the challenges and aspirations that the nurses are facing.
Hi, my name is Kate Chelsea B. Bineldo, and today I will be talking about the importance of this caricature. So the importance of caricature lies in its ability to bring attention to the significant issues faced by Filipino nurses on the global scale. It serves as a visual commentary on the challenges of salary disparities and the broader struggle for fair recognition within the healthcare sector. By encapsulating these complex issues in a single image, the caricature becomes a powerful advocacy tool, fostering awareness and understanding of the plight of Filipino healthcare professionals. In addition, by highlighting the need for just compensation and recognition of the important contributions made by Filipino nurses, the caricature adds to a broader discussion on the disparities in healthcare around the world.
Hi everyone, I'm Precious Zairayu of Dupan. In conclusion, it underscores the pressing need for equitable treatment and acknowledgement of Filipino nurses' contributions to global healthcare. Despite their dedication and expertise, they continue to face the salary disparities and insufficient recognition. Addressing these issues is crucial not only for the well-being of Filipino nurses, but also for ensuring the sustainability and inclusivity of healthcare systems worldwide. Fair compensation and recognition are not just matters of justice, but essential steps towards creating a more equitable and effective healthcare landscape for all.
So our video showcasing our two caricature, it highlights the disparity of nurses all around the world and in the Philippines. Also, based on our caricature, it shows how unfairly Filipino nurses are treated in the Philippines due to their minimum wages compared to the Filipino nurses working on the abroad. And also, despite the maximum effort of the Filipino nurses has given to the patients and their holistic care approach, they still treated poorly, and that's the reason why some of the Filipino nurses are want to work abroad. So that would be all. Thank you.